Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Medical doctor dies of COVID-19 complication in Taraba State. Ogun State government goes tough on residents who flout directives on wearing a face mask and other non-pharmaceutical protocols to prevent the virus. And UK Prime Minister Boris Johnson unveils plans to ease restrictions in the country. Since Nigeria announced the second wave of the pandemic in December last year, total number of confirmed cases and the death toll continue to rise. As at 31st December, total cases stood at 90,147, while half of the country's cases of over 61,000 have now been recorded between January the 1st, 2021 till date. The Nigeria Center for Disease Control, NCDC, reports that total active cases stand at 21,565, with a death toll of over 1,800. Last night, the lowest daily infection figures since the beginning of 2021 were recorded, a total of 521 new infections and 8 deaths. The new cases are in 20 states, which now leaves the country with a total of over 150,000 cases. After weeks of high infection figures averaging around 1,000 daily cases, the numbers seem to have reduced marginally last week and the past 3 days, with daily cases falling below 700. Today, the Nigeria Center for Disease Control is appealing to employers and business owners to keep employees and customers safe. In its fifth version of its guidelines, it says by ensuring proper use of the face mask, conducting temperature checks, providing hand washing facilities, and ensuring physical distancing. A medical doctor has died from coronavirus complications in Taraba State, a death too many in what statistics from the NCDC shows that over 36 fatalities have been recorded in the past 3 days across Nigeria alone. According to the Association of Resident Doctors, Dr. Ame Enojo died due to COVID-19 and Lassa fever complications in the course of an indefinite strike by the association. The president of NAR, Dr. Ahmed Gabriel, however, announced that the suspension of the over 7-week-old strike at a briefing in Jalingo after what he calls some interventions met by the state government.
After several meetings, we've had dialogues and discussions. The Congress of the Association has agreed to suspend the ongoing strike for the following reasons. To play its role and support in curtailing the current increasing COVID-19 cases within the state and the Lassa fever within the state and environment. Also, on a sad note, we also during the course of the strike, the death of the association also lost one of our dear colleague in person of Dr. Ame Enojo Sunday to COVID-19 and Lassa fever. Dr. Enojo Ame happens to be a medical officer in the A&E department of Taraba State Specialist Hospital, where he contracted COVID-19 and he was subsequently in isolation. But he died from renal complication on the 5th of February, 2021, while on transit after being referred to Irua Specialist Hospital in Edo State for further treatment due to lack of Lassa fever specific dialysis machine within the state.
Over to Ogun State, where the COVID-19 Special Task Force has commenced critical enforcement of the safety protocols to reduce the curve of the pandemic, which has been on the increase in recent times. The State Commissioner for Culture and Tourism, who leads the task force, describes the compliance level by residents as troubling, hence the enforcement of the protocols by the mobile court. Now, those found in breach are expected to undergo a 2-day community service if found guilty by the special court.
We are here as a result of the fact that in Ogun State and all over Nigeria, we found out that the COVID-19 index is going up. And then we have sent a circular, and there had been a lot of awareness that we should try and comply to the protocol of COVID-19. So we started with the civil servant and the public servant this morning to make sure that they comply to the COVID-19 protocol. The people were not actually complying. They were taking it with levity. There's a lot of schools of thought. Some people were saying that it's not existing. Some people were of the idea that malaria also kill people, that COVID-19 is not new. But they've forgotten that COVID-19 is more contagious. Malaria, somebody can have it and some other people can be there and it's not going to affect anybody. But this COVID-19 is contagious, it spreads very fast. And then we must also know that we human beings are the agents by which this COVID-19 are transmitted from one place to the other. And it is better for us to obey this COVID-19 protocol in order for us to make sure that we flatten the curve.
Well, staying in the southwest, the government of Ekiti State believes the call for compliance with the COVID-19 rules will lack weight if its own officials all fall short of observing the protocols. Our correspondent in Ekiti, Babajide Agbeyo, tells us more.
The consciousness of adhering to COVID-19 protocols in Ekiti State is gaining some heights, especially at government events. The state government had said that some violations on its part in the past had affected the believability of the pandemic on the part of some people. And this has made it imperative for government itself to lead by example. Now, at any government event, use of face masks and hand washing have become compulsory. At some secondary schools visited, we also noticed that students have been complying with the use of face masks to a very large extent. And at the Ekiti State University, a good number of students within the lecture halls and outside the halls have also been using their face mask and at least trying to adhere to all other protocols. Some people, however, voice their opinions on the convenience of some of these protocols.
Government has a reason for saying use this type of thing to prevent infection of COVID-19. Government has it, so I have to go by it. And it's not impossible to be the same preventing me from being affected.
Well, I use it regularly, but if I cover my nose with it, within 15 minutes I will remove it because I won't be able to breathe well. That's the only advantage.
The rules have been set. Compliance and monitoring will continue on the part of those saddled with the responsibilities.
The fact that even government officials and government functions do not completely comply with government protocols is undermining the effort. People just say, okay, if you are so sure that this is, why is this official having this party or a government activity going on here and they are not obeying COVID rules, and yet you are asking us to obey COVID rules.
Babajide Agbeyo for COVID-19 update.
While the coronavirus ravages the world, the search continues for better treatments and more vaccines to slow the spread and cut off the pandemic. Among some of the treatments over time, which also generated controversy, has been the hydroxychloroquine. We can also remember remdesivir, an antiviral medication that is set to target a range of viruses and many others. But a new drug, which seems to be on the list of speculations, is Ivermectin. Now, the Africa Centers for Disease Control and Prevention, Africa CDC, has recently advised African countries against the use of ivermectin for treating COVID-19, saying there is no conclusive clinical data to support its safety and efficacy. Well, Mrs. Folashade Lawal is a fellow Pharmaceutical Society of Nigeria, associate member, Royal Pharmaceutical Society, and also member Clinical Pharmacists Association of Nigeria. She joins us now for more. Thank you for joining us on the program.
Thank you for having me.
All right, tell us, what is ivermectin and what's it originally used for in humans, to treat in humans?
Ivermectin is an antiparasitic drug and originally it's used to combat onchocerciasis, that is river blindness, filariasis. It's also used against scabies and a few other parasitic infections in humans.
So in terms of perhaps any proven or potential users, what can you tell us about the drug? And this is also especially to treating COVID-19.
Well, it's been found to have some anti-inflammatory property, and then it's been found in laboratory studies to be effective against mRNA viruses. So it's been postulated that it might be effective against COVID, but we have not done enough clinical trials to buttress that.
But is there any clinical trial that is ongoing, for example, in Nigeria on the drug Ivermectin?
Yes, I know that a clinical trial was done, and the only issue is that the population size is small, and it's very difficult to make a conclusion as to if we should use it or not. So more trials need to be done. And I know also that currently there is research being done to ascertain its safety, looking at the safety, and that is being done by pharmacists to look at the pharmacovigilance of ivermectin. I also know that there's a group of researchers getting ready, also gathering momentum to do another research on clinical trials of ivermectin in Nigeria.
There are some school of thought who say that the big pharmaceutical companies do not want ivermectin to be used because they want to profit more from the expensive drugs to treat COVID-19. Do you agree?
I don't think so. I think that's just one of the wild thoughts. I think that, you see, in science, we don't just look at laboratory studies and conclude. We have to prove it, because it's not just about effectiveness. You have to be sure of the safety. So, and these two are still yet to be concluded as far as ivermectin in the use of COVID-19 is concerned. Yeah, laboratory studies have shown that it could be effective, but we need to apply this to human beings. We need to find out what is happening when ivermectin is used in humans, how effective it is, how safe it is. And this has to be done clinically. So until then, we cannot come out to say we want to use it.
Ms. Lawal, finally, how do we address the promotion of widespread use of such a drug, even without appropriate evidence of its efficacy and, more importantly, safety for this specific use?
Ivermectin is a prescription-only medication, so we need to advocate for that. We need to do a lot of public education. You know, we're in a pandemic. It's normal. Everybody is scared. We are wary of what is happening around us. People want anything that seems to be a solution. So we need to keep educating the public. The pharmacists are doing a lot in that. We're talking to public. We're letting them know that we should just exercise for more patience. Let's focus on what is proven to work. That's prevention. Wear your mask if you must go out. Social distancing. Clean your hands properly using appropriate alcohol-based hand sanitizer, washing your hands with soap and water appropriately. Let's do those ones that we know work. And of course, we are getting ready for vaccines. In the interim, let's allow the clinical trials to be concluded. So a lot of public education will help us.
We appreciate your time. Thank you so much for your insight into the issue. Mrs. Folashade Lawal, Fellow, Pharmaceutical Society of Nigeria, thank you for joining us.
Thank you for having me.
The Secretary to the Government of the Federation and Chairman, Presidential Task Force on COVID-19, Mr. Boss Mustafa, has appealed to Nigerians to make themselves available to receive the COVID-19 vaccine intended to be delivered to the country before the end of the month and discard any conspiracy theories and hesitancy against its administration. He was speaking to Government House correspondents in Owerri, the Imo State capital, after a short private visit to the governor. Mr. Mustafa says Nigerians should dispel rumors that the vaccine is meant to kill Nigerians, as it has been certified by NAFDAC for its emergency use.
I want to urge Nigerians that COVID-19 is not likely to go away very soon if we do not in place the pharmaceutical and the non-pharmaceutical preventive initiatives that we have advanced. Wearing of mask. What I mean by wearing of mask that will cover your nose and your mouth, and also maintaining social distancing and keeping basic hygiene, and also don't congregate if it is not necessary, and don't travel except it is expedient. As we await vaccines, I can tell you that the best vaccine you have right now is to wear your mask. When the vaccines show up, which they would definitely very soon, like you heard yesterday, NAFDAC has authorized the emergency use of the Oxford AstraZeneca vaccine, which is one of the first consignment that we are likely to receive before the end of this month through the COVAT facility, because there are two facilities we are pursuing, the COVAT facility and the AVAT facility. The AVAT facility is the African Union facility that has been put in place and resourced by Afri-Exim Bank for countries to pay and get allocated according to population. The COVAT facility is the World Health Organization coordinated vaccine alliance, where there are 192 countries involved. So I believe that as we receive these vaccines,
Dr. Esen Ukurebi is GP Registrar, Worcester Royal Hospital, England. He joins us virtually. Thank you for joining us on the program. And I'd like to start from home. And this is your thoughts on the choice of AstraZeneca for Nigeria.
Thank you very much, Millicent, for having me on the show once again. I would say regarding the Oxford AstraZeneca vaccine as a choice for Nigeria, I think it is a much more preferred option than the Pfizer vaccine in terms of issues regarding cold chain. So with the Pfizer vaccine, as you would know, you need to store that in temperatures of minus 70 degrees. And that might be a little bit problematic for Nigeria as a country, having to deal with the logistics of storing and transporting these vaccines in that kind of cold chain. Whereas with the Oxford AstraZeneca vaccine, you can store that in normal fridge temperatures, so from 2 to 8 degrees. Also, it is cheaper. The Oxford AstraZeneca vaccine is cheaper than the Pfizer vaccine. So I think it's a great choice, and it's much more preferable for Nigeria at this point.
But really, the next question is effectivity against the coronavirus and also, the different strains.
Right. Well, both the Pfizer vaccine and the Oxford vaccine, which are largely used in the UK, have been shown to be effective against the predominant strain of the coronavirus. In the UK, as a matter of fact, it has reduced rates of infections and hospital admission by 85%, that's talking about the Pfizer vaccine, and 94% talking about the Oxford AstraZeneca vaccine. There are some studies that have shown that the Oxford AstraZeneca vaccine does not protect against mild infections with the South African variant, but then the Pfizer vaccine has been shown to offer that protection. So moving forward, I would say both of them are equally effective against severe diseases, which is what everyone is concerned about.
So I also know that you're taking your first dose of Pfizer-BioNTech for a bit now, waiting to take the second dose. How are you doing?
Right, I did have my first dose of the Pfizer vaccine about 4 weeks ago, and like I said previously on the show, I just had a couple of muscle aches and fever the next day, and in less than 24 hours, I was fine. And I have since been seeing patients who are probably suspected to have COVID or who have had COVID in the past or who are currently having COVID, and I've been fine ever since. I've had several coronavirus testings as well afterwards, and they have all come back negative. So side effect wise, I would say there is nothing major as it were concerning side effects that I have experienced with the Pfizer vaccine. And in the UK, we have now vaccinated more than 17 million persons with either the Oxford AstraZeneca or the Pfizer vaccine, and there's been very little in terms of serious side effects.
Talking about the UK, are you happy with some of the announcements of lockdown ease by Prime Minister Johnson? Would you say that it is safe to ease in the stages that he has announced?
Well, it is very difficult to say if it is safe at this point or not. I think in retrospect, we can look and say if it is safe. But one thing that must be considered when easing lockdown, which I think is very paramount in this population, is the mental health of the community. So in the last couple of months, we've seen a surge in mental health cases. We've seen a surge in the issues or cases of adolescent suicide rates and things like that. So I think that we have been in a lockdown for a while, and considering the mental health of the population, this looks like a right time. Secondly, just like the Prime Minister said, he has looked at data rather than dates to consider easing the lockdown. So we have seen from the data, from studies across the world, that shows that the vaccine has reduced the rate of hospital admissions and the rate of infection considerably. Studies in Israel showed that the Pfizer vaccine has reduced the rate of infection by 89%. So those are huge numbers, and I think with that, we can have something to leverage on in terms of easing this lockdown.
All right, we always appreciate your time on the program. Dr. Esian Ukurebi, GP Registrar, Worcester Royal Hospital, England. Thank you for joining us.
Thank you very much, Millicent.
Talking about dates, not data, data, not dates. UK Prime Minister Boris Johnson has said that his roadmap will cautiously but irreversibly ease restrictions in England. He said the threat of the virus remains substantial and no vaccine can ever be 100% effective. Here's more on the global update.
With more than 120,000 fatalities, Britain has suffered the world's fifth highest official death toll from the pandemic, and its $3 trillion economy, its biggest crash in more than 300 years. But a fast start to the vaccine rollout, plus a tough near 2-month national lockdown, means government can now set out a phased easing of the restrictions in England, prioritizing the return of children to school and social mixing outdoors.
The 8th of March, of course, was the date that we want all schools to reopen, so that we work with schools, as we have been doing throughout this period, to make sure that they're ready to reopen safely. So on the 8th of March, it's 2 people being able to meet outdoors for a coffee or socially. On the 29th of March, it'll be 2 families, or the rule of 6, meeting outdoors and outdoor sports.
Meanwhile, Italy's new Prime Minister, Mario Draghi, and his cabinet have approved a decree to continue restricting movement between regions until March the 27th.
Continue to take responsibility. You can also visit our website. It's channelstv.com for more updates, a better understanding of the pandemic and several other stories, all at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.